Do you ever wonder why your hip hurts and why it's always in the same dang spot?
Well, whether it's in the front of your hip, the side of the hip, the back of your hip, or actually in this area, this location can actually tell a story of what tissues are irritated or damaged.
So in this video, we're going to go over what each area means so you can better understand what is causing your pain.
And naturally, we're going to have Sam here to help us to make sure everything is all clear. What do you say? Okay.
Bob and Brad, the two most famous physical therapists on the internet.
Welcome to the Bob and Brad channel. We are the most famous physical therapy team on the internet.
You said that pretty fast, Mike, but naturally, we have to qualify it in our opinion, of course. Again, Sam, and we have the spine. We don't have a name for the spine yet, but it is the spine.
The spine is a good enough name. So first we're going to talk about hip pain primarily in the front or anterior portion of the hip. There are 4 different common areas that can be causing this pain. The first one we're going to talk about is actually a hip flexor strain. So the hip flexors are your iliacus and so is major. Now we have represented them with this pink tape here. Don't judge us on our anatomical correctness with this pink tape, but you get the gist of where these muscles go. And sometimes they can become very tight from sitting all day long, or if you are very active in sports and have a lot of repetitive flexion motions like this with running, it can become strained.
Yeah, so these muscles are deep. In other words, you can't feel them on your stomach. They're actually below the skin, below the abdominal muscles, and below the visceral or the intestines. They're real deep, but their job is to flex the hip and pull the hip up like that. So use them all the time with walking, running, and a number of other activities. If they get irritated, sore, or tight, or damaged, it's the source of pain.
Now there is another muscle called the rectus femoris, which runs from your knee up to your hip, which we do not have taped on right now.
Well, I'll fix it.
Brad's going to fix it.
Go.
Now that one can become tight on some people as well. So just stretching your hip flexors, giving it some time to relax and stretch out can help with those issues. So that is common issue number 1 if it's more of a muscular problem. The next problem we're going to talk about is a hip labral tear. Now you normally feel that in the front, maybe more in the groin region, and your hip is actually protects your cartilage in the hip socket itself, and it can become damaged or torn, which can cause a lot of pain.
Right. The labrum is actually around the circumference or the edge of the socket. It acts as a little bit of a cushion. It keeps the ball of the hip stable in there so that the hip is more, like I say, stable and keeps you very active. If it tears or rips, it can be painful. It does not have a good blood supply, so if it does get irritated or ripped, it's a long healing process, and sometimes there needs to have a surgery if it's too bad to actually get in there and take care of it.
Now, if you're older, you may have hip osteoarthritis. So this is oftentimes wear and tear within the joint as we age. You're going to feel it typically in the front region, again, like we talked about. And Brad is kind of showing the area that degenerates.
Yeah, so the ball fits in the socket, and this is the arthritis or the cartilage that's on the ball. Here we have a exposed ball of the head right here. So instead of being nice and smooth and shiny, it gets actually rough and, maybe a little bit more like sandpaper. If you can imagine that in there and grinding around in there because lubrication and the surfaces are not smooth, it creates pain and will make the joint actually wear out where a replacement is needed.
The last common issue in the front of the hip pain region is femoral acetabular impingement.
Whoa,
so
that's a big one.
That is. So basically that means your bone is getting impinged in here, which can cause a little bone spur to develop and can cause a lot of pain within the socket. That can happen from tight muscles, lack of mobility, lack of strength. There's lots of different issues that can cause it. But oftentimes people feel like their hip may be kind of stuck to and it's not moving freely.
Yeah, I think there's some sharp pain involved with that with certain movements.
Yeah, so those are the common issues in the front of the hip, and now we're going to go to lateral aspect.
Oh, the side. Very good.
Now for the side of the hip or outer hip pain, first we have trochanteric bursitis or greater trochanter pain syndrome. So what that means is the greater trochanter is a bony landmark on the outside of the femur here, and you have a bursa surrounding it. Bursas are fluid-filled sacs which allow tendons to rub over bone without irritation, but if they become very irritated over time, they can become inflamed and often hurt.
Yeah, look, see? I got bursa. It says bursa right there. There we go.
High quality.
Yeah. So this would be the muscle, and if you lift up the muscle, underneath would be the bursa between the bone and the tendon tissue of the muscle. Are we going to the IT band?
We're going to go into the glute medius and minimus tendinopathy next,
Oh.
which is the blue area that Brad has taped up, sometimes due to weak hipness or lack of motion. This muscle can become overworked and actually start to degenerate a bit, and it can cause a lot of pain and inflammation.
Yeah, and that's oftentimes in the same area where the muscle connects. So bursitis and the
Tendinopathy are
yeah.
they overlap a lot.
Yeah, so you could have one or maybe a little bit of both.
And all this overlays into IT band syndrome, which
Ah.
goes over all this area, which Brad is going to represent with pink here. So your glute medius and minimus turn into this thick tendon that runs all the way down to your lateral knee. This can hurt up on the lateral hip. This can actually cause trochanteric bursitis, or sometimes it hurts down in the lateral aspect of the knee. So depending upon which area, it can all be due to IT band syndrome.
Yeah, and we have some videos, nice videos on how to treat a tight IT band. It's not real difficult. There's a few special stretches and some other, you can use a massage gun or a 6-inch roller to work it out as well.
Oftentimes, all of these issues arise from weak glutes. So that includes your glute max, your buttock, and your hip ab and adductors, which we had with the blue tape earlier. But now we're going to get on to pain in the back area region.
Posterior.
Now we're going to talk about pain in the buttock region, literally pain in the butt. So the first issue we're going to talk about is called piriformis syndrome. That is a muscle we have highlighted in pink here. Sometimes that muscle can become tight and irritate the nerves underneath it because their sciatic nerve, which we have represented with this really high definition yellow rope here, can become irritated as well from a tight muscle there.
Right. So when that muscle gets tight, squeezes the sciatic nerve bundle, causes pain all the way down to the foot, or it can. So we need to stretch it, loosen up that muscle, take the pressure off the nerve. So oftentimes it can be an easy fix. Sometimes it is a little stubborn, though.
Next, we have sacroiliac or SI joint dysfunction. So that is where the sacrum meets the iliac. So it looks in this little region right here. You're not supposed to have a lot of movement between the pelvis and your sacrum there, but some people get a little bit more play and it can become painful or even arthritic.
Yeah, it's like where the rubber hits the road. It's the sacrum hits the ilium. But anyways, yeah, movement there causes pain. Stabilize it, makes it better.
And the third problem that you may have is actually a referring pain from your lower back, from your L4 or L5 region. Sometimes if the nerve is irritated, it can refer pain down into the buttock. So it's not actually musculature, but it's coming from your nerve roots.
That's right. That's actually more common than a person might think. So back pain, hip pain, they work back and forth. That's when you probably need a doctor or a therapist to really analyze it.
Next, we're going to talk about inner thigh or groin region pain. Some of them may actually overlap from stuff we talked about earlier, like hip arthritis, but we're going to talk about a couple different ones here. So first is an adductor muscle strain. Now, there's lots of different muscles in there. We're not going to get into all their names, but it is represented in general by this pink tape here. Oftentimes, if you have a weird movement or maybe sports activity, specifically going in or out very hard, you can strain this muscle. Or maybe you are older and you had a fall and your leg kind of got stuck as you fell.
I've strained mine early in the spring when I first start running for the season. And it's in my 50s, and it's like I've never hurt my adductor. And sure enough, just from running, because it was a new activity, it got irritated. So the job, when the muscles adduct, they stabilize the hip for one reason, for one thing, and then they keep the femur or the leg from going out too far, stabilizes it right at the midline or where neutral position is where you want it to be. So, yeah, these can really be painful and it can make you limp. And sometimes I've said bad words as a result of.
You say bad words?
Well, when it hurts bad enough, I'm sorry. But anyways, I try to be by myself.
Next is a pubic symphysis dysfunction. Now, the pubic symphysis is this little area in between here connecting the bones, and sometimes they can dysfunction on people after an injury. Maybe it's related to sports, car accident, or during pregnancy or after pregnancy.
Mm-hmm. Yeah, that should be a stable joint as well. There's some cartilage between the two pelvics where they join, and that needs to be...
It usually takes a pretty good force to make that become loose. Obviously, if you're pregnant, it's different because you have to have room for the birthing canal. So.
Right. Yeah, that's beyond our
our comprehension
right.
since we're men.
Yeah, we're not in that part of the therapy.
The last general areas, if you just have more general pain, you have no idea where it's coming from, front, back, or side, you may just have some form of arthritis, whether that is osteoarthritic or rheumatoid arthritis. You just have some inflammation in the joint. Oftentimes it feels really deep and it just kind of aches, and you kind of know if you typically have arthritis.
So what you can do with all the information, which was quite a bit we got here for hip pain, there's a lot of different possible sources. See the area where your hip hurts, go to the part we talk about, and then Google Bob and Brad on our YouTube videos, and the part it talked about, put that in for how to fix it or how to reduce the pain, and we should get some more specific exercises for your pain location.
Yes, and another great option for any of these problems is actually to heat up the area. Oftentimes tight muscles or even tendons that are irritated can benefit from some heat. So we're going to talk about far infrared heat specifically, which penetrates a lot deeper than normal heat.
Right. The far infrared, they've done a lot of studies on this, and it will actually heat in over 2 inches through muscle and any tissues that you have on your body. A normal hot pack, just conduction, is just heats up the skin. It'll go through the skin a little bit, but that's it. You really need something like this to heat the muscle and down into the joint to improve circulation and make it more pliable. They're nice units, and they are a little more expensive for sure, but they certainly get deeper.
Yeah, they can help with tight muscles, improved circulation, joint discomfort. So this is the Thermotex Far Infrared Platinum model. They have different models, different types. This is the one we primarily endorse of theirs. Comes with a couple straps. It's pretty easy to use. You just plug it in. You have one button to turn it on and off. If you leave it on, it's not going to wreck anything. It doesn't use much electricity either. And yeah, they're a great tool. If you find heat very beneficial, it's something you'd invest in, but they are not cheap, but you do get a little bit of a discount with our link.
And the other really nice thing about it, you can use it on your hip, you can use it on your thigh, your hamstring, your calf, your hands. You can roll it up into a nice little, what do we call it? Muff to put your hands in. Actually, both hands at the same time. That's one of the benefits of the elastic strap. Pretty much anywhere on your body, so it's not just for your hip. You can use it all over.
Now, if you want to check out more videos on hip pain, you can click the video link on the screen.
There you go. What is it? 5 hip exercises to stop hip pain and replacement. So in other words, eliminate the need for the hip replacement.
Bob and Brad, the 2 most famous physical therapists on the internet.